The Awareness Project is researching ways to assist patients in their daily life by monitoring and also providing treatment when needed. To make this possible, for instance for epilepsy patients, all relevant information is captured by using a mobile body area network, or BAN. A BAN is a network of sensors worn on the body which can provide information about the health status of the patient. If there is sufficient bandwidth, such as at home using Wi-Fi, the BAN sends all medical information to a health center. In low bandwidth conditions, only the most essential medical information is sent. If there is limited network connectivity or none at all, it is essential that a seizure can be detected locally by the device that the patient carries. The healthcare professional can view the medical sensor data and judge the patient's condition. In case of an emergency, help can be dispatched immediately. But also during everyday life, chronic patients can benefit from smart awareness solutions. By monitoring daily movement, the system, supervised by the therapist, can give timely advice to the patient. Knowledge about your situation is important. This information is what we call context. Suppose you have a digital coach who reminds you to do exercises as prescribed by your physiotherapist. But in some situations, you don't want to be distracted just now. If your context is known, exercises can wait and reminders should be avoided. Location is important context information. For instance, the location of the patient and location of caregivers. So is the kind of activity, such as being in a meeting, working, traveling or sleeping. Means of transport, such as train, bus or bike. And physical activity, such as sitting, walking or running. Your mobile phone, or PDA, is a useful device for detecting context information. When you're at home, your location or movement can be determined more accurately than when walking in the forest. This is because your mobile device may detect GSM cells, UMTS cells or Wi-Fi access points, which differ in range and therefore accuracy. The difference in accuracy is what we call quality of context. When a healthcare professional makes decisions based on context information, it is essential that we make clear what the quality of that context information is. We can make context information more meaningful and of better quality by applying reasoning techniques. Are you at the office? Is your mobile phone set to silent? Is a meeting planned in your digital calendar? It can be assumed you're actually in a meeting. Context information is privacy sensitive, and the context infrastructure must ensure your privacy. Your doctor should only be able to see where you are when it's really needed. However, during an emergency, help can only be dispatched when your location is known. Is it okay for you if your partner can always see where you are? What about your neighbor? We believe, as a user, you should be able to control who gets access to your context information. By giving explicit consent, you can determine who is allowed to see your context information, when and how accurately. In the future, demand on care will increase, while the number of caretakers will decrease. It is therefore essential to put in place efficient healthcare processes without compromising quality of care. New medical treatments can be tested at the patient's own trusted environment, their home. The concepts that are being developed within awareness will mean more freedom, security and safety for patients at risk. Awareness is part of Freeband, a Dutch research program aiming to create a leading position in the area of ambient intelligent communication.